Hello, my name is Dr. Robert Boostanfar here at HRC Fertility in Encino and Westlake Village, California. I did my undergraduate training at the University of California in Los Angeles, my medical school, residency, and fellowship at the University of Southern California. After matriculating into the University of Southern California School of Medicine, I was blessed and honored to be trained by some of the top obstetric and gynecologic surgeons in the United States. After being mentored by some of the professors at USC, I found the path towards reproductive endocrinology and infertility the most rewarding, taking care of both male and female patients towards a combined goal of helping them create a family. One of the defining moments of my medical training was when a close family member of mine was struggling through fertility and shared with me in medical school if I knew any doctors that could help them. When I found out that they were struggling locally here in the Encino community, I referred them to the University of Southern California, where I watched and witnessed them become successful in carrying twins. And to this day, I get to see my favorite set of family members grow up to be adults. And it was through this one moment that I found such a personal connection with the field of reproductive medicine. Personally speaking, starting our family a little bit later in life, as both my wife and I are professionals, we deeply understand and sympathize with the process of assisted reproduction to help extend our family. We are both blessed with a son and a daughter and really understand the struggles, the hardships, the waiting for the pregnancy tests, the negative tests, the positive tests, the first trimester, all the fears and the unknowns associated with early pregnancy and even with the second and third trimester. We realize it's very difficult, and to say that we have walked in your shoes and empathized with you is really something I hope that you can take away from, and your doctors here do understand, and it's not just a day-to-day job for us, that we understand it, and we really hope that you will find good success in our practice. One of the cornerstones of our success is the IVF laboratory personnel. These are the heroes behind the scenes, working day in and day out, 365 days a year. Due to the fact that we're doing thousands of cycles of IVF annually for the last 35 years, patients seeking treatment either domestic or internationally are fortunate enough to have such experience that almost any case is completely treatable here at HRC Fertility. As director of the clinical research here in Encino, HRC Fertility is one of the largest fertility centers in the United States that provides not just assisted reproductive technologies for couples struggling with infertility, but we have participated in more phase 3 clinical trials than any other program here in Southern California. I have worked with several pharmaceutical companies throughout the last 20 years, helping develop new and novel stimulation protocols and procedures for in vitro fertilization. We are at the forefront of reproductive medicine, and many of these clinical trials have helped couples who normally could not do IVF with completely complementary treatment due to the pharmaceutical support. We hope we can continue doing clinical trials here at HRC Fertility in Encino, and we also hope that these trials will bring new therapeutic approaches and modalities for the future. Every year around October, we have a baby reunion where couples come from the past to share the success that they've had here at HRC Fertility. Seeing these couples out of a moment of crisis and in a moment of happiness and satisfaction with their family really recharges my batteries for another 12 months until the next baby reunion. Our approach towards patient care is using a small team of nurses, generally one nurse with a backup nurse that's assigned to each patient, so that when you come to the office, you'll be familiar with seeing me. sometimes seeing an ultrasound tech or a physician assistant to help facilitate the visits scheduled to be a little bit more timely. And more importantly, a continuity of care that comes from the doctor all the way down to the nursing staff. We feel that with a high complex procedure like IVF, we don't want information or facts to fall through the cracks that could occur when multiple doctors or the doctor of the day is taking care of you. Here at HRC Fertility in Encino and Westlake Village, your doctor will help shepherd this process single-handedly from your first visit to your last. This is Dr. Robert Boostanfar. I hope I have the sincere pleasure and opportunity to help take care of you from the first visit of your assisted reproductive technology consult to your last visit when you're graduating in the first trimester. We hope that all of our patients, whether they are domestic or international, find a positive and successful outcome here at HRC Fertility.